All right, so RSV is respiratory syncytial virus. It's a virus that affects kids and elderly, affects everybody, but there's certain people who are definitely at higher risk. And those would include your children, especially kids under the age of 4, uh, especially extremely preemies, kids born early, premature, low birth weight, the young kids. These are the ones who actually die of apnea and bradycardia. So they actually are at risk. Younger children under 4, this preschool age, they just usually have a runny nose, cough, cold, but they can have increased work or breathing, for which they come to the emergency department for respiratory distress. The other folks are the elderly, over 65, the usual category group, because they're frail, older, and have other complications, may have respiratory distress. They don't have a strong heart, and have difficulty breathing, or have other underlying medical conditions, those who are immunocompromised, and those who are just not able to move around or ambulate as much, or in nursing homes and other facilities, group areas where the viruses can be shared and spread. These are the families and patients at risk. So the two extreme of ages, the extremely young and the older, elderly population, and those who are frail, those would be the ones I would say at high risk. So now they're starting to, there are different things and approaches that we can use to take care of these patients, but it's the same playbook of masking, hand washing, protecting yourself, social distancing as the virus does spread. And it is on surfaces, and also from droplets that definitely do spread from person to person. So what other things are out there? Treatment management, it really is supportive care, but there are some vaccines that are out there. And you really have to talk to your provider about this to see if that is something you want to take. You and your provider share that medical decision making to say, this is something that's good for you. I know those who are at risk of giving you those extreme of ages, those would be the ones that should benefit from a vaccination. But again, talk with your provider. There are new developments in terms of the vaccines. Check www.cdc.gov so you have some latest updates. And of course, I've given you the natural things that you can do and the behavioral things you can do. I think all those together will help protect you during this season. Yeah, so RSV, how do they present? I'll just go by patients I saw in the ER, especially the extreme of ages. The young kid, I saw an 8-month-old who came in, had a fever to 102 degrees Fahrenheit, had increased work of breathing. The chest was going in and out, sucking in and out. The mom was a first-time mom. They've never experienced this with their child. The child has no other underlying medical conditions, but had increased work of breathing. Mom was concerned. She brought the child in. I assessed the child, and yeah, he's working to breathe. The chest was literally sucking in and out really fast. The child seemed in distress, pretty much crying and whimpering and laying there in pity. Just couldn't really breathe. Oxygen saturation was low. It was like 89%. So the normal should be about 95 to 100. We'll accept 94 sometimes, but this was 89, and the kid was working to breathe. The kid looked dry, wasn't eating or drinking as much. So yeah, every parent would freak out. I would. So they did. And we started the kid on some oxygen. I assessed the child, and calmed mom down, and reassured her. We gave the patient some fever reducing medicine. Started some breathing treatments and did some nasal suctioning because the kid had a lot of mucus, a lot of secretions. And sure, 2 hours later, after treatment and everything, the child improved, but did not improve enough to go home that day, and had to have what we call high nasal flow cannula, where we give some oxygen to help open the airways a little bit better and for support, and was admitted to the ICU, the intensive care unit. So those are the things that we kind of see. Some have to be transferred from other hospitals. Some are flown in. I mean, it's not something to play with. So definitely learn about RSV, especially for your children and for the elderly adults. They usually will present with respiratory distress or difficulty breathing, and supportive care is what they need. Sometimes they end up in the ICU too. So yeah, that was the case I saw. The kid made it. Fortunately, 4 days later, got out of the hospital, and I followed up with them.